indeed we have a long journey with the healthcare providers in this county. Everybody is a shareholder in that success of Nakuru. I am happy that there has been progressive improvement in healthcare. And we believe in the next 2 or 3 years, there will be no reason whatsoever for anybody to go beyond our borders to seek any form of medical treatment, because we have invested sufficiently and trained our people, our doctors for that matter, to make sure that we are moving on well. I believe Nakuru can reverse and become a destination for medical tourism.
Greetings wherever you're watching us from, and welcome to Between the Lines. I'm your host, Karanja Jackson. On my clipboard today, we speak health. And in studio today, we are privileged to have the CEC Health Services here in Nakuru County, Dr. Kariuki Gichuki. Welcome to the studio.
Thank you for having me.
And thank you for finding time to actually come here. So, Bona Daktari, we were watching a clip of the health progress in our county. Please tell us something about it.
The clip we're watching mainly is on infrastructural development, and a lot of residents of Nakuru will agree with me that one of the biggest challenges of our health care system was infrastructure. And this is informed by the following, that 55 to 60% of our health problems are what we classify as non-communicable diseases. Non-communicable diseases are diseases which you cannot transmit from one person to the other one. And I'll give an example, like diabetes, hypertension, psychiatric illnesses, such diseases, cancer. So the infrastructure we had was mainly health centers and dispensaries, which were for treating communicable diseases, the old ones that we know, which now are not the causes of our morbidity or what makes people sick. So really, if we have to give first class care, we have to invest in infrastructure so that we can put in the services that are required, so that we can be able to treat cancer. You already know we are doing it here. We are able to do neurosurgery here, orthopedic surgery, and such things. And we are doing it all over the county, starting from Naivasha. We are doing an outpatient department. And it is common knowledge that every time there is an accident up there at Kinungi, our outpatient in Naivasha is messy. It's too crowded. It's not ideal for handling such cases. So we are doing an accident and emergency center there, which is very good, so that if there is an accident, the other clients who have come for other services won't have to see all that mess. It will be handled elsewhere. We are doing it in Gilgil, Naivasha, in Nakuru, Njoro, Elbagon, Molo, and Orengurueni. We imagine by the end of maybe the next 12 to 18 months, when all this infrastructure is done, we will be able to give our clients very quality healthcare. Yes.
Thank you, Dr. The big question.
Yes.
The COVID-19 situation in our country, and especially in our county.
Yes.
Day by day, we witness numbers surging, and right now we are hitting high numbers after every other day.
Yes.
So, basically, what is the situation of the COVID-19 here in our county of Nakuru?
Okay, as we speak today, we have tested about 5,954 people, and out of those, we've got 194 positive cases.
Yes.
You will see between now and when Nairobi was locked and Mombasa,
Yes.
by the time Nairobi was opened, we had 77 cases.
Okay.
Now we have 194.
Yes.
So you can see we've almost doubled, actually, and something
And
above,
something
almost
above.
tripling now.
Yes.
And therefore, you can see this is not a very good trend. Obviously, for a county like Nakuru, which is big with a population of about 2.2 million people,
Yes.
that might look like a small
Yes.
figure, which is true,
Yes.
because we really tried in the initial stages
Yes.
to make sure that we contain it.
Yes.
Now the floodgates are open.
Yes.
We are going to some uncharted waters,
Yes.
but still we have procedures and what we intend to do
Yes.
so that we keep it contained.
Yes.
Yes, so we are not throwing our arms in the air, hands in the air, and really saying
And shouting that all is lost.
yes.
So, we are grateful that this fact sheet has actually been shared also with our station. We have 194 confirmed cases.
Yes.
As to today.
Yes.
With 57 recovered numbers.
Yes.
And 4 deaths.
Yes.
Which is a bit tragic.
Yes.
Then 40 are on treatment.
Yes.
17 here in PGH.
Yes.
And 9 in Naivasha, 14 in Langalanga Level 4 Hospital.
Yes.
Let us speak a little bit about these numbers and those on treatment. What is the capacity of, maybe in terms of beds, that we have here in PGH and in other facilities around the county?
Okay, thank you very much. Our intended capacity as per our population is about 1,000 beds, and you might remember His Excellency the Governor saying our projection is that we have enough beds so that we are able to take care of our people.
Yes.
As we speak now, we have over 400 beds.
Okay.
And I'll tell you how we have created those beds. And those are empty beds.
Okay.
In total, if we are to count the number of beds we have in the county, they are almost 3,000. But those are occupied by other conditions, because diseases are still around.
Just
PGH has almost 800, and every other of the 16 level 4 facilities also have beds.
Yes.
So having said that, our capacity is good. You can see we have 40,
Yes.
and our bed capacity is 400. So we've only occupied for 10% of our bed capacity.
Yes.
So it might sound like good enough, but it is not good enough.
Yes.
We need to have res admissions. One good thing about the kind of clients we are seeing is that 80 to 90% of them are asymptomatic. Asymptomatic means they do not have symptoms,
Okay.
the ones that we've been telling you about.
Yes.
And therefore, these are people who do not require serious medical intervention, and therefore we can manage them at home using the protocols that have already been developed and the national policy on home-based management of such clients, if they meet the criteria for management at home.
Yes.
And that is why if you look at our statistics also, you'll see that we are doing a lot of now home-based care,
Yes.
which is good enough. This will free the bed space. Because even the ones we already have, like the 40 patients we have, none of them is on ICU or ventilators, but we still have those equipment.
Okay.
Yes.
That is quite remarkable.
Yes.
Last week, the Equity boss, Mr. Mwangi, Dr. Mwangi, alongside several other members, made several donations to the county government of Nakuru.
Yes.
Would you tell us what exactly did we receive as a county?
Okay. We received personal protective equipment, and mainly there were surgical masks and the suits you see us wearing.
Yes.
I want to be less technical.
Okay.
The ones you see us wearing in the isolation facility worth about almost 3 million shillings, or thereabout, which was a very kind donation to us.
Yes.
The county itself had already planned well in advance, and we have stocks to last us up to October of this year. Of course, we know that this COVID-19 thing is likely to go beyond that, and therefore the appropriate budgetary allocations has been made. The most important thing, and that is what Mr. Mwangi insisted then, is that we really have to jealously protect our healthcare workers, because when everybody else is sick, we will run to them. And therefore, we need to give them the appropriate equipment. And that is what we've done. If you go to any of our health facility, including the smallest, like a dispensary or a health center, you will find our workers with PPEs and a thermal gun before you enter, so that at least we can take a basic temperature. This is meant to not only protect our own staff, but the other clients who have also come for services.
That are not related even with the
COVID-19.
Speaking of healthcare workers, our county here so far has 6 healthcare workers that have tested positive with COVID-19. And a report last week indicated that a total of, as per then, 429 healthcare workers had actually contracted COVID-19. Is this something worrying? And what should be done?
Yes, it is. First and foremost, healthcare workers are also part of the community. So really they can get it anywhere, at the community or where they work. But they are more at risk because they work in very special areas. And that is why we are asking our people to spare a thought for our health workers. Because when all of us don't do the right things, the ones we've been told repeatedly, the simple things, like not going to crowded places, wearing a mask in crowded places, washing your hands frequently with running water and soap, sanitizing. When we don't do those things, we are likely to contract COVID-19. And when we get seriously sick, or we interact, or we are in bad health, we will end up with a health worker. And that is why our health workers are most at risk. So we really cannot tell where these people got it, but it is true we have them, and we have treated them. I think only one of them is remaining, and he is in good shape. He will go home. As a county, we've made sure that we protect them fully. One, by providing PPEs. 2, we have a full NHIF cover for them, which is very good.
Courtesy of the
county government, yes. And finally, you know of the Annex Hospital. It's a 64-bed hospital. We refurbished it very well and put in ICU beds and ventilators. We've set it aside as a field hospital for our own workers, because we have around 3,000 health workers. So if any health worker is on line of duty, is not feeling well, we'll pick him, take him there, and we'll treat him, and he will be well. We've also trained our staff very well. We have a complement now, the real training for management of patients. We have a complement of almost 600 staff. Yet, and all the other staff have been sensitized. Sensitized means they have been told about the basics. Above the average Kenyan walking on the streets, they know something. But we have a complement of about 600 staff who have fully been trained on case management. And these involve very serious specialists like physicians, anesthesiologists, theater nurses, ICU nurses. And these are the people we've kept aside just in case we have very serious cases. And I think we are managing well. So for our health workers, maybe at the risk of sounding repetitive, because I've told them so before, we are taking care of you. We know that you are at a special risk, and this is something that you wake up every day to go and do day and night. A lot of people forget that health works 24 hours. We can get COVID even at 3 a.m. ourselves because you're working there.
Speaking of preventive measures, we are witnessing, and as you've mentioned, a surge in the number of cases of COVID-19. Here in Nakuru County especially, we have seen the police and also the members of the county enforcers enforcing the wearing of masks, where we've seen people arrested for failing to wear the masks. That aside, let us go to the other measure that we talk about, the sanitation. are we doing enough? Or is the county government doing enough to ensure that businesses and other places that people are visiting, the measures of sanitizing and cleaning of hands is being done? Because we are only seeing people being arrested for not wearing masks. What about these other measures?
First, even if now I don't speak as a CEC, I speak like a Kenyan.
Yes.
It is really tragic that anybody has to be arrested, or we have to enforce it using the police to wear a mask. At security, how do you take at your personal security? Every time you walk around the streets, you are conscious of yourself.
Yes.
In the evening, when you go home, you lock the door, you switch on the light. If you have a small dog, you unleash it.
Yes.
Why don't we have the same kind of consciousness when it comes to health?
Yes.
Having said that, it is important that we take our health more seriously than we are taking it as Kenyans. I do not think it is it is a very present thing, even when our children are watching, that a old adult like me has to be told by a policeman to wear a mask. Yet, the benefits of wearing it, everybody understands, because a lot of public awareness has been done, not just by the county, but by national TV, including yourselves. I've seen you doing it. So we want to ask our people politely that why don't we just follow these simple rules? And they are so simple, they are repeated often every day on TV and radio, and when we do that, things will be very easy. Apparently, COVID-19 is a disease which requires what we call a public health approach to eliminate it. Because if it doesn't move from me to you, then it is nowhere. It will die a natural death. So how do we do it? It is not an issue of hospital and beds and anesthesiologists and that. It is an issue of the public at the community level, taking the initiative to protect themselves first as individuals, as their families, as their community, as a county, and even as a country. If we do, can you close your eyes and imagine today everybody doing all those good things? Wearing a mask, washing their hands, sanitizing, not going to public places if they have nothing important to do. This thing would clear it in a month or two. And it is that simple. Yes.
It's impressive that you've mentioned about not going somewhere because you don't have something to do.
Yes.
Now, the government has repeatedly asked members of the public, and the president himself has called out members of the public, telling them to avoid these mass gatherings. Day in, day out, Mr. Waziri, we witness government delegations and top politicians meeting in different places on different issues that they're discussing. Isn't the government shooting itself in the foot, saying this and yet doing something else?
The jury is out there. History will judge some of those people very badly. And I wish to reserve my comments because they wouldn't be very polite.
Okay.
Because I think as we need to show others the way, especially if we are in leadership. So, and as a public health expert myself, I think the details that have been given on what everyone should follow, they are so simple. You would wonder why anybody would fail to understand them and go contrary to them. Well, you put these things in the... COVID might not be here forever. We'll have the time to do all the things we want to do some time ago. Don't we feel guilty every time when those figures are read and then we hear mortalities, morbidities, and all the economic mess is bringing around, even in our own county, here in Akuru, businesses are almost on their knees. Why don't we just do the right thing? Yes.
Thank you, Dr. Kariuki. This is Between the Lines, and in studio today we have the CEC in charge of health services here in Nakuru County, Dr. Kariuki Gichuki, who is helping us discuss the COVID-19 situation in our country and in our beloved county. We'll take a small breather. Keep sending in your questions. Keep sending in your comments. The hashtag is Between the Lines. We will be right back. Welcome back. The show is Between the Lines here live on Nakuru TV. You can find us on our different platforms, YouTube, Facebook, Twitter, and Periscope. In studio today, we are discussing matters of health, and we are happy to have the CEC in charge of health services here in Nakuru County, Dr. Kariuki Gichuki. Before we went for the breather, we were you mentioned something about people and the observance of just the modalities given in trying to address the COVID-19 situation. And you are an epidemiologist. Epidemiologist. What does that mean?
Okay. So I'll break it into very small details so that people can understand.
Yes.
An epidemiologist is a public health expert.
Yes.
Who deals with diseases, what causes them, who has them, where did it come from, how is it spread, in which age group, how do we control it, and actually moves into action to define how we do it.
Okay.
So COVID is my space. Feeling good.
Very nice. And I think the county of Nakuru is glad that you are at the helm during this pandemic. Now, Mr. Waziri, there has been a question about the need to open the economy versus the need to protect ourselves. The government, and you have mentioned that our numbers, especially here in Akuru, have taken a surge since the government lifted the cessation of movement in several towns. Do you think it will be wise of us to again close down, because the numbers are increasing by the day, every other day? And the government had indicated that after 21 days, it will give another directive on what to do. Do you think it is wise, or it would be prudent of us to close down again and try and contain the situation in our country?
Okay, thank you for that. It's a difficult question. And, everything runs on money, including health.
Yes.
And health, also for people to be healthy, they must eat, they must take a shower. Right?
Yes.
They must be under a roof. All these things are about money.
Yes.
So it's more of a balancing act, because you can never have a perfect situation.
Yes.
Because even before COVID came,
Yes.
we also had other illnesses
Yes.
that are transmissible from one person to another one,
Yes.
like maybe tuberculosis and such.
Yes.
So on this particular case, COVID is not very old. Okay, we know coronaviruses have been here before,
Yes.
and they have been infecting people. This thing called COVID-19 is caused by a coronavirus, which is a relative of the ones we know. Like the Middle East thing and the Southeast Asian thing, where we had that flu. Those are coronaviruses. This particular one, up to December, none of us had seen it. We only saw it the other day. So really, it's a running process, and it's more of balancing. And as we learn from people who had it before, like the Chinese, the people in the European Union, like the Italians, Spaniards, the Brits, now the Americans and the South Americans, and India of late, and Brazilians. Really, there is no rule of the thumb on how to go about it. It's more of balancing the status of your economy and your health. What if you had a full-blown infection? What is your system capable of tackling it? How is the social security systems? Can we afford as a country to give people stipends can we maintain their livelihoods? So really, it's more of balancing. We need the economy to run, because if it doesn't run and we have no money, others places will suffer. Security will suffer. Provision of other government services, businesses. So really, it is balancing health and economics. A perfect balance. And that one can only be done by a multi-sectoral approach, not by doctors alone. People who matter in designing how do we move forward so that we balance all those things.
Yes.
We can't stay closed forever. Yes. We can't.
We can't. The fact sheet that we were looking at, it detailed that we have 5 county COVID-19 isolation facilities.
Yes.
Where are these located?
Okay. As we speak now, we have one at the provincial Nakuru level 5.
Yes.
You are aware the I unit. The I unit was a bit separate from the rest of the infrastructure.
Yes.
So we converted that one into an isolation facility. And we moved their unit to a separate building.
Okay.
That is one. We have one that is in Akuru West Sub-County. We have another one at Langalanga. We had built a ward there. We wanted to start a pediatric hospital. It was complete.
Okay.
So we decided to change it into COVID-19. We have annex hospital upstairs and downstairs. That one we've put aside, and as I had alluded to, we're putting it basically for our health workers, and even the ones who work in the private sector, because we don't have a patient for the private sector and one for
the public.
Then from there we go to Naivasha. We have a center there in Naivasha, and it has, I think, 9 patients today.
Yes.
In Gilgil, we had built a 40 million new maternity, and it is finished now. We want to convert it into a COVID center because the numbers are likely to rise, and you don't want to get overwhelmed. And then at the PGH, you are aware we were building a 600 million outpatient complex. This outpatient complex can handle 500 beds, and we are in the process of turning it into a COVID facility. In other sub-counties, like in Subukia sub-county, we are doing an isolation facility at Nyamamithi. In Molo, we are doing it at Molo Hospital, and also at Sachangwan, we have a structure there, and also in Kuresoi South, in Orenguruni. So we are preparing ourselves, although, as I told you, the bed occupancy now for COVID patients is about 10% of what we have now. But you can also see the projections are such that we are likely to have more cases. So we need to get, well prepared, so that we are not running when the issue is here in our hands. Yes.
Keep sending in your questions, your comments, using the hashtag Between the Lines. And the discussion today is about health in our county of Nakuru. Mr. Waziri, there was a question that was brought to us. What is the difference between an isolation center and a quarantine zone?
Okay. We start with an isolation center. An isolation center is where we keep a client who has been tested and found positive for COVID illness.
Yes.
And is on management. A quarantine center is where we keep someone who might, for purposes of this description, a suspect.
Okay.
A person who was in contact with a positive patient, so that we keep him there, observe him, and then when he completes the number of days required, we can test him to see if he's positive or negative. So if he becomes positive and he is in a quarantine facility, we will transfer him from there to an isolation facility. If he is negative, we will transfer him to his home. So between home, if from home you come to a quarantine. If you are positive, you climb to isolation. If you are negative, you go back home. Yes.
Speaking of home-based care,
yes.
How is the county government ensuring that this is done to its totality? Do you have people on site, or what is being done exactly?
Okay. The success of home-based care is based on several things. And the best thing about it is what I told you, that most of our clients, 80 to 90%, are asymptomatic. And therefore, if they meet the criteria to be managed at home, where they can be separated from the rest of the family, that is the best way of doing it. How is the county government prepared to do this? One, we have what we call community strategy, where we have developed community units everywhere in the county. A community unit is the lowest level of care in healthcare. We call it level 1. So we have trained about 1,100 community health volunteers, and these are anchored around either a dispensary or a health center. And we have trained 90 community health extension workers. These are people who are either public health technicians, public health officers, or enrolled nurses or nutritionists who are stationed in a dispensary or health center, but they move into the community to work with the community health volunteers.
Yes.
Yes.
Now, speaking about the patients that they recover and they go back.
Yes.
is the county government doing something in regards to stigma? Because we've witnessed it in other places,
Yes.
where individuals that were previously positive of the disease, when they go back to the community, the tendency of them being shunned or labeled as watu wa corona is there. What is the county doing?
First and foremost, it used to be there a lot. There was a lot of stigma around those people. It still exists, but at least now on a scale of 1 to 10, it's around 5. It used to be like 8, 9 there. Largely because Kenyans are getting used to this thing every day on TV and radio, and corona is coming near home. At least you can hear even in our county here, we have almost 194 and counting. And therefore, going forward, what we've done as a county, every time we release a patient from our isolation facility, he's transported home, and before he gets there, the community, the public health officer, will have visited their home and talked to the neighbors. The one who is being managed at home on home-based care, a health worker visits them often, first to take their temperatures and to see that they are doing well, and also to talk around with the neighbors. And we can see people now are slowly getting used to it, as in they don't look at it as a very alien thing, but the stigma is still there anyway. Yes.
Do you think that element of getting used to it is playing a part in the surge in numbers? Because people will be like, after all, someone also got it and recovered. Does it have a relation to it?
You see, COVID-19 is not something like, say, a bad disease like, say, Ebola, which the mortality rate is very high. In our case here in Nakuru County, our mortality rate is about 2%. So that is what we call now case fatality rate. And the 3 of the 4 deaths that we've had in this county are actually from outside this county. Only one is from this county. So the rest of them are walking around, and people here, he had COVID, and he's at home, and he looks okay. So we wouldn't want it to be bad, but we want to tell people there is a very thin line between where you run from asymptomatic to symptomatic. Where you really have, like I can tell you for sure here in Akuru, we haven't gotten those very serious cases, like the ones who require ICU facilities and such. We haven't reached there yet, but we know it is coming. So it is good enough to let the people know, don't allow yourself to get into this kind of circumstances. Yes, because when we lose you, it's a total loss to you and to your family and to people around you. Well, we talk as a country or as a county, we talk statistically, which really ignores you as the person, and we don't want to get there. Yes.
In the fight against COVID-19 here in our county, and you had alluded to maybe the donations that have been made, as well as their allocation by the county government in regards to the fight against COVID-19. Several times, and I have in our duty and in our lines of work, we have gone to slums around Nakuru, and the people down there will tell you, I would want to buy these things, but I do not have the money. What is the county government trying to reach to that mwananchi down there to ensure that these people have the required PPEs for protection, that is maybe the mask, and also maybe access to sanitation, water, and such things?
Okay. Maybe I want to make it clear that the masks that we've been talking about in this interview are medical masks for health workers.
For health workers.
Yes. And these are medical grade, like the one I was wearing. So in the community, you are aware that the county had a program where it was producing 55,000 masks per week, and they were being distributed in our 55 wards in this county, and it is a continuous process. Those are not medical grade, and they are washable. Clients or a resident can use them for several times before they get another one. Now the one I'm wearing here is a surgical grade, and it's a disposable. You use it once and remove it. This is what we are giving our health workers. So all those things we are talking about are not for the public. They are for the health workers. Yes.
Comments are coming in. A lot of people are watching and they are happy with the discussion that we're having. Ben Karunga says salute to all those people who are fighting COVID-19 in our republic, and salute to you, Bwana Waziri. Then Cephas Senyenjo says it is us to kick out COVID-19 out of our communities by becoming more disciplined. Maybe something that you had actually alluded to, that it is down to we as individuals to take part in the fight against COVID-19. We'll take another small breather. When we come back, we will wrap up the discussion. Please keep sending in your comments, questions using the hashtag Between the Lines. Thank you.
Over the past few months, our country has stood together to keep the COVID numbers down. The numbers are important because they decide how the society. At Safaricom, our numbers also tell a story of hope, resilience, and recovery. Every day, new numbers tell us the same story, that we never let what we can't do come in the way of what we can. Let's keep going.
Indeed, we have a long journey with the healthcare providers in this county. Everybody is a shareholder in that success of Nakuru. I am happy that there has been progressive improvement in healthcare.
And we believe in the next 2 or 3 years, there will be no reason whatsoever for anybody to go beyond our borders to seek any form of medical treatment, because we have invested sufficiently and trained our people, our doctors for that matter, to make sure that we are moving on well.
I believe Nakuru can reverse and become a destination for medical tourism.
Testing. The issue of testing has been rally with many counties, Nakuru included, not having a laboratory that can test. And it has been on record that most counties are outsourcing. They're doing the tests, but the results have to be picked from somewhere. Is this affecting the fight against the virus?
Yes and no. First, I would say that no county really has an inbuilt lab of its own, which has been operating to do COVID.
Yes.
It's mainly a national government function.
Okay.
And maybe to correct. But for the other clients, we take the samples and
Over the past few months, our country has stood together to keep the COVID numbers down. The numbers are important because they decide how the story unfolds. At Safaricom, our numbers also tell a story of hope, resilience, and recovery. Every day, new numbers tell us the same story, that we never let what we can't do come in the way of what we can. Let's keep going.
Welcome back. The show is Between the Lines, and today we have in studio Dr. Kariuki Gichuki. He's a CEC Health Services here in Akuru, and he has been helping us discuss the COVID-19 situation in our county, and especially and also the health sector here in our county. Now, Bwana Waziri, testing. Does Nakuru County have a testing lab that will help in getting these cases and also ensuring that our fight direction?
Okay, thank you. Nakuru County does not have a testing site, but we have a site which is operated by the national government at Maimahiu, which is within this county.
Yes.
And it's mainly meant for truck drivers.
Yes.
You are aware that we have an inland container depot at Naivasha. And half of the cargo that runs in Kiridini now is ending up there for onward transmission to the western side of the country and our neighbors.
Yes.
So that's why it is important to put it there. Having said that, no country really has inbuilt structures to do a COVID test.
Yes.
Most of what is in those other places is actually national government function. They are the ones running it. Nakuru is planning to have one at PGH, but even that one will be pressed by the national government, and we shall operate it. We've already trained staff, laboratory people on how to do it, and we are ready when it comes.
How soon can you give an estimate?
I cannot give an estimate because it involves procurement by the national government and such, and placement, and that is not within the information that we have.
Okay.
Yes.
Speaking about the inland port at Naivasha, and now the truck drivers that are moving from the lower parts of the country, Mombasa, and then to Nairobi, all the way to the western parts.
Yes.
Does the positioning of Nakuru put it at a risk of having a surge in numbers based on this movement of truck drivers?
Certainly, yes. Certainly.
Yes.
And even there are some facts that you haven't mentioned. You see, Nakuru County is the second biggest county in terms of GDP after Nairobi County. Nairobi does like 21% of the GDP.
Yes.
Nakuru is number 2, doing 6.1% of the GDP, followed by Kiambu and Mombasa, etc.
Okay.
And that tells you this is a center of trade. And it's also a transport hub for passenger vehicles and a lot of businesses.
Yes.
And there's a lot of movement between here. And Nakuru is central to almost everywhere. You can move from here to Nairobi, to Narok, to Kisumu, to Eldoret.
Yes.
So that by itself is a risk because viruses move with people.
Yes.
We also know that we are in a northern corridor. Among all the counties from Nairobi westwards, Nakuru has the greatest length of the northern corridor, all the way up to the western side near Mau Summit there. And you know the stopovers we have, famously, Maimahio, Kikope, Salga, and Total. And finally now the Inland Container Depot.
Yes.
A very good investment by the national government and very nice for us. But then it comes with the risks of, because almost half the cargo from Mombasa ends up there. Then you can see all the stuff there, clearing and forwarding, services, truck drivers. Maimayu now, all of a sudden, is a very congested place with people from everywhere. I'll tell you, some of the people we have in our isolation facilities aren't even Kenyans. DR Congo, Burundians, Rwandans. But since they were caught with COVID here, we have to manage them. Yes.
Oh, okay. So, speaking of the measures by the government in setting up these centers, like the one that you've mentioned here in Maimahio, and now it hastens the testing.
Yes.
What about the results of these other people that are tested now? That the results have to be picked from the main testing sites, laboratories in Nairobi, and it takes maybe 3 to 4 days.
Yes.
Does that delay the addressing of COVID-19 in these counties?
Yes, because if we take your sample today and we got the results 2 days later, if it comes positive, it means you are positive when we took the sample.
Yes.
And you're walking around, mixing with your family and others. So that is not very okay. Of course, we understand the challenges. Even in other countries, even very advanced ones, they still had those challenges to start with.
Yes.
So in going forward, what we should do as a county and also as a country is to make sure that the results are released within the same day, within the 24 hours that it has been taken. That one will help us in controlling it, the community transmission, because we will get you well in good time and put you where you belong, either home-based care or in hospital. Yes.
Away from COVID-19 related, but just something related to it, is the issue about mental health.
Yes.
And we have seen, even in our televisions, we've read it in newspapers, there's a surge in cases of mental health issues, mainly because of the pandemic that we're witnessing, maybe directly because of the socio-economic implications that are coming with it. Is the county government doing something to address this?
Thank you. First and foremost, mental health has always been a very big problem here in this country, even before COVID came.
Yes.
For various reasons, ranging from the changing social settings that we have. You know, people have been moving from the rural areas where things are a bit sociable, coming to towns. We have drug abuse. We have a lot of issues.
Yes.
Money issues and such, and of course there are the original organic illnesses that we know that are psychiatric in nature. So then maybe we should confess here as a country, and this has been a confession made by a lot of people, I'm not the first one, we haven't really invested very well in mental health care. But I'll tell you about Nakuru. Did you know Nakuru has the second biggest mental hospital in this republic, based in Gilgil, where we handle clients from a lot of places.
Yes.
And we have referrals from about 10 counties surrounding us. And also at PGH, we have a mental facility that deals with mainly acute cases. We have psychiatrists, we have psychiatric nurses, at least in every sub-county hospital which you go. And we have about 15 level 4 hospitals. You will have psychiatric services. We haven't done as well as we should do, but we are way ahead of a lot of other people. And that is good for us, because going forward, we need to invest in mental health care. And now with COVID, we see the problem being exacerbated, because mainly people are indoors, maybe they are idle, their businesses are down, they are jobless. You know, the ingredients for these mental illnesses that trigger, they are all over now. And therefore we need to invest more as a country by training more human resource, having more infrastructure, having more medicine, having a service delivery system that is geared towards taking care of people with mental health issues, and having a governance system so that we look at that properly. Yes, if you look at other places, the other place you find a mental hospital is maybe Nairobi, Mathare, and Mombasa, Port Reitz. and a few in maybe Moi teaching referral. The rest of the places there is nothing. So really we need to invest there.
Okay.
I agree.
So, as we wrap up, Bwana Waziri, what are some of the milestones, or we could put them as achievements, that the county government has seen in regards to health?
Oh, I would take the next 12 hours to tell you.
Maybe in highlights.
I'll be very, very, very brief. Since the current government came,
Yes.
your viewers have just been seeing the major infrastructural developments that we've made. Because we sat together with our boss, who listens to us professionals, and we told him, we advised him that we have to orient our health system where our problems are. And our problems, people in Nakuru these days don't die of small things like diarrhea, malaria. We have serious things, and this is meant to be a joke though, like diabetes, hypertension, heart issues, cancers, road traffic accidents. This is what is finishing our people. So we need to move that way. And he told us to have a blueprint and a strategy on how to do that. That is how now we are putting that infrastructure to take care of those things. That is why we can treat cancer very easily here in Akuru. We can do neurosurgery here. We can do orthopedics here. A lot of people refer to us, ENT, everything. Then staff. We have had a very good relationship with the human resource here in Nakuru. You haven't heard of any strike of rate. We pay them on time. We have promoted them, and we take good care of them, because we realize a health system is very labor intensive. If we don't take care of a human resource, which is the most important ingredient in provision of healthcare, we'll have a lot of trouble. Medicines. You walk into any facility in this county, from a dispensary up to PGH, for the last almost now 20 months, we've never missed those things. We have what we call a pool system. We buy mainly from KEMSA, Kenya Medical Supplies Agency, where the facility orders, the order comes to the headquarters, we rationalize it, and then it goes to KEMSA. And KEMSA distributes directly to the facility where the drugs are received by the health workers and the facility committee members. And then the delivery note is hung at the notice board so that you see. Maybe something I would want to clarify on maybe health products is that health products are distributed as per level of service delivery. It means simply, if you go to a dispensary, we don't treat cancer there, so you won't find cancer drugs there. If you go to a health center, you won't find the same. Even a level 4 hospital like Moro or Naivasha, we don't do dialysis at a dispensary. And therefore, the drugs for that will not be found at the dispensary. But there is what we call essential drugs for each level. So if you went to a dispensary today in Nakuru, the essential drug list that's supposed to be in the dispensary is there. If you don't find it, the next level is a health center. If that level is not to be found there, you go to level 4. There are some drugs, if you went to a level 4 hospital like Molo, you won't find. But you will find them at PGH because it's at level 5. If our people understand that, then they will know that we don't distribute all the drugs in PGH to the small dispensary. Because either the people to prescribe are not there. You won't find a consultant there, you won't find a doctor. So people should know. Having said that, we've also put a very robust system of monitoring and evaluation so that we know how our clients viewing us in terms of service delivery. Are they happy with our services? And I'm happy to note, although this might be looked at like blowing our own trumpet, the ratings that we're getting are very good, and the indicators are there. For example, our patient numbers have improved tremendously for the last 2 years. Also, a good indicator of workload is also the money we collect from NHIF, the rebates. When we give services to our clients, NHIF pays back. And before this government came, we used to collect about 500 million. Now, this last financial year, we did 1.1 billion. That is an indicator that people are coming and NHIF is paying us. That means we are doing well in terms of the people seeking services from us. Imagine they are satisfied with our services. Yes.
Okay. So what is that last message you will tell the viewers that are watching us, the Kenyans and the people around the globe that are watching us, in regards to the fight against COVID-19?
It is very simple. This thing is in our hands. Even if we were to build all the hospitals, and we can't admit everyone, and that puts the responsibility back to us, like the president said some time ago. And I want to repeat what I have just said here. What if you close your eyes and imagine all Kenyans washing their hands dutifully, often with running water and soap, or using a sanitizer, having a face mask, social distancing, having cough etiquette, all those good things. This is a very simple thing to work around with. And I imagine if everybody did that, it would be a smaller problem. I think, and now I'm talking like a Kenyan, sometimes we have a problem of attitude. And also we also have a problem of assessing risk. We don't see it as a big risk until our neighbor collapses and dies. This is not the way we should. Because bright people are from others. You don't wait until the thing hits you. So I want to urge our communities kindly and politely, please follow those simple procedures and we shall be safe. And even if it is not for yourself, why don't you even do it for your family? Or maybe to express my own vested interest for my health workers. Because when all of you are sick, you will come to my health workers and you overwhelm them. So kindly spare a thought for my health workers and your family and yourself. It will be good for all of us. Yes.
Thank you, Bwana Daktari, and thank you for finding time to come to the show.
Thank you.
We wish you the very best going forward. Yes. It has been Between the Lines. I've been your host, Karanja Jackson. We have been discussing matters of health, the COVID-19 situation, as well as the health issue in our county of Nakuru. Until next time, stay safe.